Hello and welcome to the Victory Education Lounge, your go-to place for cutting-edge insights and knowledge that empower your mind and future. Today, we're embarking on an enlightening journey into the world of artificial intelligence, or AI, and its transformative role in health surveillance. But before we delve into the heart of the matter, let's lay down the basics. Health surveillance is the cornerstone of public health. It involves the systematic collection, analysis, and interpretation of health-related data. This continuous process allows us to plan, implement, and evaluate public health practices. It's our first line of defense against health threats, enabling us to detect, monitor, and respond to potential epidemics swiftly. In a world where health threats are always on the horizon, staying one step ahead is not just beneficial, it's crucial. This is where the power of artificial intelligence comes into play. AI, with its ability to process and analyze vast amounts of data at lightning speed, is revolutionizing the field of health surveillance. We're not just reacting to health threats anymore, we're moving towards predicting them. Imagine being able to identify patterns and anomalies in health data that would take humans considerably longer to notice, if at all. AI is making this possible. It's transforming how we approach public health, equipping us with the tools to predict potential epidemics before they happen. Consider the impact of such technology. By predicting outbreaks before they occur, we can mobilize resources, inform public policy, and implement preventative measures. The potential to significantly reduce the spread and impact of diseases is immense. But as with any powerful technology, the path forward is not without its challenges. From data privacy concerns to the need for global cooperation, the integration of AI into health surveillance raises important ethical considerations. In this journey, we will explore the benefits, the workings, the successful instances, the challenges, and the ethical implications of AI in health surveillance. Today, we're exploring how artificial intelligence, or AI, is revolutionizing the field of health surveillance and enabling us to predict epidemics before they even happen. By integrating AI into health surveillance, we're not just reacting to epidemics, we're moving towards predicting them. This shift from reactive to proactive is made possible by the incredible processing power of AI, which can sift through and analyze vast amounts of data at a speed and precision that far surpasses human capabilities. Imagine a global health network that never sleeps, tirelessly combing through mounds of data, seeking out the faintest whispers of potential health threats. This is the reality of AI in health surveillance. From hospital records and lab reports to social media posts and climate data, AI algorithms can ingest and analyze a wide variety of data sources, identifying patterns and anomalies that might indicate the emergence of a disease outbreak. But the power of AI doesn't stop at data collection and analysis. It's also instrumental in generating predictive models, providing an early warning system for potential epidemics. By recognizing patterns in historical and real-time data, these models can forecast the likelihood of an outbreak, allowing us to take preemptive action. The role of AI in recent health crises cannot be overstated. AI-driven tools have been at the forefront of early detection and response efforts, providing critical insights that have informed public health strategies and undoubtedly saved lives. For instance, during the COVID-19 pandemic, AI was instrumental in tracking the spread of the virus, predicting hotspots, and informing resource allocation. In essence, AI is transforming the field of health surveillance, turning it into a proactive rather than reactive discipline. It's helping us move from merely responding to health crises to predicting and preventing them. This shift holds immense potential for public health, promising a future where epidemics can be anticipated and mitigated before they wreak havoc on our communities. AI can identify patterns and anomalies in data that would take humans much longer to notice, if at all. This capability, combined with AI's predictive power, is revolutionizing health surveillance, presenting us with a powerful tool in our fight against epidemics. AI models are trained on vast datasets, from hospital records to social media posts, learning to identify early warning signs of disease outbreaks. These models, often referred to as machine learning algorithms, are programmed to identify patterns, anomalies, and correlations within the data they process. This ability to sift through mountains of information and extract meaningful insights is at the heart of AI's potential in epidemic prediction. In the realm of health surveillance, these AI models are fed a variety of data. Hospital records, for instance, can provide a wealth of information about the types of illnesses currently affecting a population. This can help identify unusual spikes in certain diseases, which may signal the beginnings of an outbreak. Social media posts, on the other hand, offer a real-time snapshot of a population's health. By analyzing trends in what people are talking about online, AI can detect early signals of a potential epidemic. For example, a sudden increase in tweets about flu-like symptoms could indicate an impending influenza outbreak. Once these early warning signs are identified, the AI models then use predictive analytics to forecast the trajectory of the potential epidemic. This involves analyzing the patterns identified in the data and using mathematical models to predict how the disease might spread. These predictions can then be used to take proactive measures. This could mean mobilizing healthcare resources, implementing public health interventions, or informing public policy decisions. The aim is to prevent the outbreak from escalating into a full-blown epidemic, or at the very least, to mitigate its impact. The power of AI in this context is truly transformative. It allows us to shift from a reactive stance, where we're constantly playing catch-up with disease outbreaks, to a proactive one, where we have the chance to get ahead of the curve. These models can then forecast potential epidemics, allowing for proactive measures. The potential of AI in predicting epidemics is immense, and as we continue to refine these technologies, the promise of a healthier future becomes increasingly tangible. The impact of such technology is profound. Let's delve into a case study that brings to life the power of AI in predicting disease outbreaks. We turn our attention to Blue Dot, a Canadian AI company that astounded the world in December of 2019. Their AI system was among the first to identify the emergence of a concerning cluster of pneumonia cases in Wuhan, China. This was almost a week before the World Health Organization released its first warning about what we now know as COVID-19. Blue Dot's AI was trained on multiple sources of data. This includes global airline ticketing data to track population movements, reports from animal and plant disease networks to identify potential zoonotic sources, and official health documents in all UN official languages. By integrating and analyzing these diverse datasets, the AI was able to pick up on the unusual pneumonia outbreak and alert the human team at Blue Dot. The early warning from Blue Dot allowed for a quicker response to the emerging threat. While it's difficult to quantify exactly how many lives were saved or infections prevented due to this early detection, there's no doubt that the early warning provided valuable time to prepare and respond. The Blue Dot case study shows how AI can sift through vast amounts of data, detect patterns, and raise an alarm before an epidemic becomes widespread. It's like having a vigilant sentinel tirelessly monitoring the health landscape, ready to alert us at the first sign of danger. But the power of AI doesn't stop at detection. Once the Blue Dot system identified the outbreak, it went a step further. By analyzing global flight data, the AI predicted the initial spread of the virus from Wuhan to cities in Asia, Europe, and America. These predictions were later confirmed to be remarkably accurate, proving that AI can not only detect, but also predict the trajectory of an epidemic. This prediction capability is invaluable in the fight against diseases. It allows us to mobilize resources and implement preventative measures in areas predicted to be hit the hardest. For instance, hospitals can be prepared for an influx of patients, public health messages can be tailored and disseminated, and policies can be put in place to slow the spread of the disease. Moreover, such predictions inform global cooperation. By knowing where the disease is likely to spread, countries can work together in their response efforts, sharing resources and information to combat the common threat. The Blue Dot case study is a testament to the power and potential of AI in health surveillance. It illustrates how technology can help us stay a step ahead of diseases, giving us a fighting chance in the battle against epidemics. By predicting outbreaks before they occur, we can mobilize resources, inform public policy, and implement preventative measures, significantly reducing the spread and impact of diseases. This isn't just the future of public health, it's the present. And as AI continues to evolve and improve, our ability to predict and prevent epidemics will only get better. However, the path forward is not without its challenges. As we navigate the integration of AI into health surveillance, we encounter a landscape filled with both potential and pitfalls. On one hand, we have the promise of early detection and prevention of epidemics. On the other, we face complex ethical considerations that demand our attention and resolution. One of the most pressing issues is that of data privacy. With AI models being trained on vast amounts of personal health data, questions arise about how this information is collected, stored, and used. As we strive to harness the power of AI, we must also ensure that individuals' privacy rights are respected and protected. This is a delicate balance to strike, and it requires robust data governance frameworks, transparent practices, and stringent enforcement of privacy laws. Another challenge lies in the inherent biases that can be present in AI algorithms. These biases can result from a lack of diversity in the data used to train the models, leading to inaccurate predictions and potentially exacerbating health disparities. Therefore, when developing and deploying these AI systems, it's imperative to ensure the data is representative and the algorithms are transparent and explainable. The implementation of AI in health surveillance also calls for global cooperation. Epidemics do not respect borders. They can spread quickly and widely, affecting people in every corner of the world. Therefore, predicting and preventing them requires a collaborative global approach. This means sharing data and resources, coordinating efforts, and working together towards a common goal. However, this can be challenging due to geopolitical tensions, differing regulations, and issues of trust and transparency. Lastly, we must consider the impact on the healthcare workforce. While AI can augment and enhance our capabilities, there are concerns about job displacement and the need for new skills. It's crucial to provide education and training, not only to use these new technologies effectively, but also to understand their limitations and ethical implications. The path forward may be fraught with challenges, but they are not insurmountable. By fostering dialogue, promoting ethical practices, and encouraging international cooperation, we can navigate these obstacles and harness the full potential of AI in health surveillance. In conclusion, the integration of AI into health surveillance is a complex journey, filled with both promise and perils. It's a path that requires careful navigation, balancing the immense potential of AI with ethical considerations of privacy, fairness, and global cooperation. But it's a journey worth embarking on. Because at the end of the day, the goal is to protect and improve public health, to predict and prevent epidemics before they happen, and ultimately, to save lives. And so, as we continue to explore the frontier of AI in health surveillance, let's remember to do so with care, responsibility, and a commitment to ethical practices. Because the promise of AI is not just in its ability to predict epidemics, but also in its potential to promote a fair, equitable, and healthy future for all. The integration of AI into health surveillance raises important ethical considerations. The potential of AI in health surveillance is immense, offering a beacon of hope in our ongoing battle against epidemics. As we've seen today, these technological advancements are not just about predicting health threats, but about empowering us to act preemptively, to marshal resources and implement preventative measures before an outbreak occurs. We've delved into the many advantages of integrating AI into health surveillance. The ability to process and analyze vast amounts of data at lightning speed, identifying patterns and anomalies that might escape human analysis. This is not just about reacting to health crises as they unfold, but about shifting towards prediction, towards proactive public health strategies that can significantly reduce the spread and impact of diseases. We've also seen how AI models, trained on a diverse range of datasets, can detect early warning signs of disease outbreaks. From hospital records to social media posts, these predictive models harness the power of data to forecast potential epidemics. The implications are profound. With early detection, we can direct resources where they're most needed, inform public policy, and put preventative measures in place, all before an outbreak takes hold. But let's not forget, this journey into the future of health surveillance is not without its challenges. We've touched upon the ethical considerations that come with such advancements. Data privacy, the need for global cooperation, and the importance of navigating these challenges with care and transparency. These are not hurdles to be overlooked, but opportunities to shape a responsible and ethical framework for AI in health surveillance. In the face of these challenges, the potential of AI in health surveillance shines brighter than ever, illuminating the path towards a healthier future. A future where epidemics are predicted before they happen, where public health strategies are proactive rather than reactive, and where the power of technology is harnessed to safeguard our health and well-being. As we refine these technologies, as we continue to navigate the ethical landscape, the promise of a healthier, safer future becomes increasingly tangible. A future where the power of AI is fully realized, where health surveillance is not just about monitoring, but about predicting, about empowering us to stay one step ahead of health threats. The potential of AI in health surveillance is immense, a beacon of hope in our ongoing battle against epidemics. And with every step we take on this journey, with every challenge we overcome, we move closer to that future, a future where health threats are predicted before they happen, where the power of AI is fully harnessed to safeguard our health and future. Thank you for joining us at the Victory Education Lounge. Remember, knowledge is the first step towards victory. If you found this video insightful, don't forget to like, share, and subscribe.